So, good morning, good afternoon, good evening, depending on where you are, everybody. Thank you very much for joining this webinar. We're going to be talking about disaster resilient public financial management. What is it? What does it mean for the public health sector? And I'd like to welcome you very much on behalf of the Rebuild Consortium. My name is Sophie Witter. I'm the co-research director of Rebuild for Resilience, and we're delighted to host this webinar today. So I'm going to start by just giving a little bit of introduction to Rebuild itself as a consortium. I'm struggling to actually move my slide on. It's not a good start to a webinar when your slides don't move. So let me just stop sharing and share again and see if that solves the problem. So 1 minute, excuse me. Okay. This is not solving the problem. Kate, can I send you the slides and see if you can share on my behalf? Would that work better?
Yes, you can certainly try that. Give it a go.
Apologies.
No worries. Do you want to keep speaking to them and then I'll...
Yeah, I'll just send you them and then I'll carry on.
Okay.
Oh, yeah. Okay. So Rebuild for Resilience is an RPC that's funded by the Foreign Commonwealth Development Office in the UK. We're working with 4 partners in Lebanon, Nepal, Myanmar and Sierra Leone, and also 2 affiliates, IRC and Oxford Policy Management. And today's webinar is co-hosted with Oxford Policy Management, so one of our affiliates. So just to frame it, our focus is on developing resilience capacities to ensure responsive, effective, inclusive, gender equitable and sustainable health systems in fragile and shock-prone settings. So we are working with a resilience framework which looks at a number of domains, as I said, our focus is very much on a positive perspective of how do we support and develop the capacities, including at the local health system level. And the framework we've developed, which you may or may not be able to see, depending on whether Kate is able to share the slides, focuses on a number of pathways. And one of the pathways is around the availability of resources and the extent to which those are able to feed into sort of strategic and flexible use of pathways to adapt, absorb and transform as country health systems are hit by shocks and crises. And we look at how that relates with many other domains, including the health workforce, data systems, monitoring, networks and collaboration. So that's the very sort of broad framing of why we're interested in this topic, because obviously the public financial management system is a key component of enabling that kind of flexible and adaptive response, and indeed also supporting emergency planning and preparedness. So why are we interested in public financial management? What is it? Very broadly, PFM refers to the laws, institutions, systems and processes by which public resources are planned and managed. So it includes the mobilization of resources, allocation, execution and monitoring, and our presentations today are going to be speaking to all of those. So a kind of model that's been given for PFM is like the kind of plumbing of the system. So those pipes need to be maintained, they need to be improved to ensure that public service delivery is effective and sustainable. So very much seen as a necessary but not sufficient condition for good health and wider development outcomes. So I'd like to introduce you briefly to the session and also to our panelists today. We're going to be starting with a regional perspective, So the first presentation is given by Danielle Cirabro of CABRI. So CABRI is the Collaborative Africa Government Reform Initiative. And she's going to be presenting on research on managing public finance at a time of crisis in Africa. So looking at the kind of COVID experience, looking at areas such as emergency procurement, also budget reallocation trends and systems, and tools for supporting budget execution and accountability. So Danielle is a development economist who's worked with many African governments to improve the management of their public debt, build PFM capacities, and improve linkages between public finance and service delivery. So that's our first presentation, and feel free to put questions, comments, clarifications in the question and answer as the speakers go through, but we then will have a dedicated session at the end to bring those together and address them across the panel. The second presentation today is taking more of a national country perspective. It's going to be looking at also disaster PFM, but also disaster risk finance and how it's relevant for health system resilience. We'll be looking at how to make PFM systems more resilient to disasters. And this presentation is drawing from the Building Resilience in Ethiopia programme, which is implemented by Oxford Policy Management, looking across the budget cycle and with a focus obviously on the Ethiopian health sector, and looking at the engagement between the health sector and other actors to push the agenda of PFM reforms. So we've got two presenters for this session. One is Fantahun Asfar, who served in the Ministry of Finance of the Ethiopian government in different capacities, working on macroeconomy and also on public financial policy design and implementation. He's also worked in Liberia and is currently working for Oxford Policy Management as a disaster risk finance workstream lead on this project. The second presenter is Stephanie Allen, who's a principal consultant in OPM's public financial management team, working with governments to improve the management of domestic resources for service delivery, and has worked in a number of countries, including South Sudan, Myanmar, Ethiopia, and Lebanon, and particularly written about PFM, climate change, and disaster risk. The final presentation today will be moving to the subnational level, and here we're going to be looking at some work that's been done in Pakistan. So this is led by Mujib Khan, who is the Subnational Governance Programme Director. He's a governance expert with a focus on government reforms, working with ministries of finance and planning to improve the way that governments prepare and execute budgets, and creating strong institutions to develop and sustain that capacity. And he's going to be looking, as I said, at work in two provinces of Pakistan on how to make PFM systems more resilient to climate change. We'll then move on to getting comments from two discussants, very well placed to react to these issues. Our first is Dr. Hélène Barrois from WHO, and she's going to be looking at the sort of early budget formulation stage of the budget cycle. She is a senior public finance expert in the Department of Health Systems Governance and Financing, with more than 20 years of experience, specialising in budgeting, PFM, budgetary space for health, and indeed her group has produced a number of really important policy guidance notes in this area. Our second discussant is Moritz Piatti, from a senior economist at the World Bank. Again, very well placed. He's working at the nexus of public finance and health, and looking at how public financial management reforms can be important for enabling efficient and equitable service delivery. And he's going to be focusing more on the budget execution issues that arise on this topic. And then we'll move on to 20 minutes of question and answer, I hope, and discussion between the panelists and any critical issues from our audience. So that was a bit of a long introduction, but I'd like to move then straight away into our first presenter. So over to you, Gabrielle. Thank you. The floor is yours.
Hi, everyone. Let me just put it into presenter mode and then I'll get started. There we go. You should be seeing
That's
what
good. Yeah,
okay,
we
great.
can see it.
Okay, great. So thanks very much for including me in this webinar. I think it's a very important topic, and this essentially is our presentation of some of the work we did during COVID. In about April 2020, we started collecting in real time data from ministries of finance and ministries of health and how they were responding to the crisis through reprioritization, through resource mobilization, social assistance, so tracking throughout. And then we produced some analytical reports based on that. So I'll share some of the findings of that now. So my presentation will just take you through some of the regulatory and institutional adjustments made at the onset of the pandemic, and then just some of how financing was mobilized to respond to the crisis, and then some trends in supplementary budgets in the first year of the crisis, and then looking at emergency procurement mechanisms and some of the health financing adjustments and transfers to local government authorities, and then looking at how the crisis spending was tracked and accounted for, or wasn't in some instances. So we know that around 30 African countries declared these states of emergency, which gave unusual spending power to the executive and allowed for ruling by decree and streamlining procurement and disbursement procedures. Often the legislature was bypassed in these instances. We also saw that countries did often have emergency provisions in their PFMAs, but they were very high level and how they could be applied was often unclear. So in the Seychelles, for example, they could introduce a supplementary budget, but how they would do that was unclear, which slowed down the process quite significantly and led to debate in Parliament about the legality of the amendment.
Excuse me, we can see your notes as you scroll down them, so I don't think you're entirely in presentation mode.
Okay.
Yeah.
I think
that's much better. Perfect. Thank you very much. Sorry to interrupt.
No, thanks for that. So, as I was saying, where there were emergency provisions in the Public Financial Management Act, how these were applied was often unclear. We also saw that a lot of countries introduced these high-level interministerial committees, and that these were really important for managing the COVID funds that were set up, and also for making spending decisions in some instances. We also saw that business continuity planning across the continent was in a nascent phase and was very underdeveloped. So most Ministry of Finance did reduce to essential staff, but were completely unprepared for remote working. In Liberia, for example, which had experienced the Ebola epidemic, they took a very drastic step and actually stopped 75% of the Ministry of Finance workforce for 4 months. So obviously with huge efficiency implications. So the South African National Treasury, that's where I'm based in South Africa, had quite a developed business continuity plan, one of the more advanced on the continent, but there was no provision for complete off-site operations. So that had to be developed very quickly. A good example was the Ministry of Finance in Rwanda, which actually managed to fully digitalize its payment system within 2 weeks. So previously there had been manual processes for, we had to print and sign documents and then take them to the Treasury, who then had to manually take them for processing payment. And what very quickly happened within 2 weeks was that they managed to digitalize fully the payment system. And this they said paid tribute to the local development of the system and the fact that they had the local expertise in-house. We also saw that fiscal rules were suspended throughout the continent. So in the Waimu region, West African region, sorry, I think it went to the next. Fiscal deficit, the fiscal deficit target was abandoned, and they're only looking to converge back in 2026. CMAC also allowed for deficits and debt to increase, but they want to revert next year. And we also saw that special COVID-19 funds, extra budgetary funds, were set up across the continent in about 28 countries at least. And most of these were off budget, which obviously has transparency implications. So we saw that only 4, Chad, Nigeria, Senegal, Zambia, were actually on budget. So obviously it's well known that government revenue declined quite significantly in 2020. Many countries introduced tax relief measures on top of the reduced revenue that was from the crisis. There was about 36 countries that did this in the continent. And these were mainly direct tax measures, but there were also some indirect tax measures and even increases in those. It's been estimated, this is an Africa Development Bank estimate, that around $68 billion was allocated in 2019-20 and about $63 billion in 2020-21. And that's about 3% of GDP. So you can see it's a huge resource burden on all of these countries. What we also saw is that most countries didn't have contingency reserves in place. And even when they did, they often weren't adequately funded and weren't used. So Kenya, for example, decided to rather use the World Bank's catastrophe drawdown option, and that even though they had a contingency fund. So Uganda was an exception here in that they actually did use, and they funded around a fifth of their crisis response in 2019-20 from their contingency reserve. Obviously, that's a very quick source of money. As the CAT DDO is also, that's been credited for Kenya's very fast response. They managed to get the money into the bank account within 2 weeks of applying. And then additional resources came in the form of grants, of concessional and non-concessional loans, debt relief from the DSSI, and then some more innovative financing mechanisms. We saw that debt increased significantly. That one innovative financing mechanism that we saw was that Zambia introduced a COVID-19 bond, which they used to fund partially the health response, but also the economic response. And then Ghana, which introduced a COVID-19 health levy. So that was an increase in the national health insurance levy, which was already in place. And then they also increased by 1 percentage point in the VAT flat rate. And this actually managed to cover 23% of their response in the first year, in 2021. So quite a significant amount of money raised in that way. So as I said, this was some of the trends we observed in the supplementary budgets passed in the first year of the crisis. So we saw that out of 50 countries that we looked at, 36 had produced a supplementary budget. It's obviously quite a significant number. There were a downwards trend in about a third of these budgets, and around 13% downwards. We also know that supplementary budget procedures are often simplified, and this is usually the case, but was also the case in COVID. Countries didn't submit as much documentation, but we did see that some countries did include medium-term expenditure framework in addition to the budget, which just created a little bit more stability for the 9 ministries. We also saw that some of these supplementary budgets were passed very late in the year. So Kenya actually passed their 3rd supplementary budget the day before the end of the financial year. So obviously limited spending on that. So you can see there was quite a significant variation in the amount that countries did increase and didn't increase. And then these are some of the changes that were made within these supplementary budgets. So often we observed that there was just across the board cuts. So there was really no strategy behind it. And I think this is why the work that is being done on the budgetary allocations by Stephanie and her team is so important, because there really seem to be no clear ideas of how to start cutting. So the decisions were made by senior officials in the Ministry of Finance with really no consultation with ministries, with line ministries. And in some instances, MDAs were asked to present savings, but then they weren't asked to present cash plans or procurement plans. So it was really unrealistic, and they were given a very small amount of time to do this. This was the feedback from countries that we spoke to. And in some instances, there was this interministerial committees who actually decided on that allocation decisions, but that wasn't as common as sort of unilateral decisions, either in the presidency or in the Ministry of Finance. We also observed that costing these additional in-year resources was very difficult. So that was one of the reasons why WHO's tools like the Civic tool was very useful for countries, because they didn't seem to really know where to start and what would be required. So international assistance was very valuable there. We also observed that non-essential services that were cut first, which makes sense, things like travel, entertainment, but also salary increases were cut. We also saw that the social sectors were impacted. So you can see in this diagram that a lot of countries did cut education spending, which we all know made sense because a lot of schools were closed. Some countries did increase that. But then we also know that non-COVID health programs suffered quite significantly. And I'll show you the impact on the health budgets in the next slide. But we also saw that the change in CAPEX wasn't unanimous. So some countries did actually increase capex, and often related to the crisis response. Capex is obviously quite an easy thing to cut, especially in this COVID crisis where you couldn't really go out and actually implement projects. So that is normally a first line of defense. We saw that with Ebola as well. So looking specifically at health now, this is just a subset of countries that I've included here, looking at some of the increases to health. So health was normally the first port of increase, understandably. This was the same in the Ebola crisis. We saw Liberia increase their health budget by 111%, which ended up being about 60% of the budget. So very significant increases. And that these reallocations generally went to goods and services and recruitment of additional personnel, sometimes infrastructure, as I mentioned earlier, but this was always COVID-19 related. So the health budget on the whole didn't receive any benefit and often saw cuts, as I'll mention now. We also saw that several countries introduced new sub-programs specifically to allocate funding to the response. There was the disease surveillance and response sub-program added in Kenya, the fight against COVID-19 in Burkina Faso, and just the COVID-19 response program in Malawi. I'm sure Helene will comment on this, but it's unclear whether this did actually improve accountability. Kenya actually seemed to spend under a completely different program, and their health policy and standards program was 63% overspent in 2019-20, and that's where they seem to allocate most of the COVID expenditure. And as I just mentioned, the increase to health didn't necessarily go towards strengthening the health system. It often led to a neglect of other diseases. In Zimbabwe, resources were allocated away from HIV and AIDS. In South Africa, I'm sure you're all aware, we're trying to introduce this national health insurance, and funding was taken away from that, quite a significant amount. In Côte d'Ivoire, Comoros, and Ghana, the malaria programs were affected. Another thing that we looked at quite a lot was budgeting for COVID-19 vaccines, and found that these were just completely excluded from 2020, 20 and 2021 budget. Countries knew that this was coming, but they just didn't seem to be prioritizing it. Sort of informal discussions seemed to imply that countries were so fiscally constrained, and they hadn't necessarily been hit very hard by these crises. So at that stage, vaccines weren't necessarily a priority. They were also relying very heavily on the international community. But even in 2021-22 budgets, these still weren't necessarily apparent. May have been hidden somewhere, but our analysis showed that they weren't there. And then looking at procurement, many countries didn't actually even have any sort of emergency procurement provisions. But where these did exist, they were very incomprehensive, and there was a lot of deviation notices issued for COVID-19. Some of the more common responses in adjusting procurement processes was the centralized procurement. So some countries thought this would be an efficiency gain. South Africa initially decentralized, and then there was a lot of corruption and inefficiencies, so re-centralized. Other countries did decentralize procurement. Then there was single sourcing, which is understandable in this kind of emergency, but obviously also has corruption implications. And then there was a very common step was to actually provide advanced or expedited payments, because private sector providers weren't necessarily willing to supply or didn't have the liquidity to supply, and were also used to the buildup of arrears. And so there was a lack of trust amongst countries. So we also saw that international organizations such as UNICEF, even the Global Fund, the AU, were responsible for a significant portion of this COVID-19 related procurement. Obviously is some concern for the many countries that are transitioning away from donor support that their procurement systems aren't necessarily capable of responding in emergencies or in usual times. We also saw some of the challenges that have been highlighted. This is by countries and a World Bank study that was released in 2021, there was a lack of digital procurement systems, or that these weren't very developed across countries. The procurement needs was often unclear, and this again relates back to the planning and the costing. There was fairly poor coordination amongst the different entities that were procuring. And yeah, those were some of the key challenges that we observed. And although countries did commit initially to very stringent transparency mechanisms in terms of publishing beneficial ownership, publishing contracts, advertising the bids. These didn't often materialize, and often they were part of commitments to receive IMF or World Bank funding. So it seemed that there was some, sort of malicious compliance, or that there wasn't necessarily follow through on this. I mean, this is throughout the world. African countries, probably there is even more transparency on this than there was in a lot of developed countries. But we did see corruption was widespread. There was irregular use of direct procurement. There was procurement without signed contracts, late delivery of goods or non-delivery of goods, and then payment before receiving goods, even when it wasn't allowed. So there was advanced or expedited payment that was made provision for in the deviation notices, but often, even when that wasn't there, that happened. This is in terms of how transfers to local government agencies was done poorly. So often in countries, we noticed in Nigeria, Malawi, and Uganda, there seemed to be an allocation to COVID or a conditional grant, but not necessarily with consideration of how COVID had actually manifested in those counties or districts. So districts at the border, for example, were often affected significantly more, but didn't receive more funding. And this wasn't, in Malawi, for example, there was just a flat allocation of 100 million kwacha. So clearly some sort of equity and efficiency issues there. And then we also saw that delays in transfers were very common throughout the continent. South Africa had a pre-existing provincial disaster relief grant. So they used that to very quickly allocate funds to the provincial departments, and that was used for initial PPE needs. So that worked well for South Africa to get the money out there. In Ethiopia, there was a lack of coordination between central and regional governments. And I'm sure this was in many other countries. This is just an observation from Ethiopia, which obviously made the resource allocation and disbursement difficult. A lot of governments agreed to provide COVID-related services for free or highly subsidized, and some did include them in their health benefit packages. Cameroon, for example, updated its health benefit package to include COVID testing, hospitalization, and medication. And Ghana added to that isolation, to cover isolation during when someone was infected with COVID. And then in Rwanda, the Ministry of Health actually fully incorporated this into the health insurance, and they urged hospitals to start invoicing and claiming from the insurances rather than directly from government. So that was in about early 2021. And that's just a notice that the Ministry of Health sent out, letting facilities know that they should start billing insurance rather than the government. And that works very well in Rwanda. They have 90% coverage through their community-based health insurance or mutual. In reality, governments couldn't always afford what they had committed. We know health benefit packages are often not resource constrained, and this was the case here too. In Ghana, providers weren't always reimbursed, and then some providers actually either charged patients despite the government promising to provide the services for free, or actually turned patients away because they knew they weren't going to receive their payment once they submitted their claims. And then my second last slide, just looking at tracking of crisis spending. So IBP, the International Budget Partnership, has done a lot of work on this and have reflected that governments published very little information on actual versus planned spending and financing performance. So we don't really know how efficient COVID spending was. And that's something that I think really needs to be investigated. Was there value for money? So that's something that there isn't necessarily disaggregated data on that. Some governments did use the information system in innovative ways. I already spoke about the case of Rwanda, which managed to digitalize payments very quickly. Benin actually modified their IFMAs to track in-kind donations. So that was, just receiving masks or vaccines without financial transfers. Togo tracked cash transfer payments, and that the intention there was to reduce the risk of fraud or delays. And then we also saw fiscal transparency or data portals, which were regarded as being important for ensuring the transparency of emergency spending. There's an example, it's in French, from Côte d'Ivoire about how their allocations and subsidies to small and medium enterprises. So they did that bi-weekly and monthly updates, and that provided information on eligibility conditions and subsidies paid to beneficiaries. And then finally, participation and accountability, as in most crises, was fairly limited. Citizen participation was almost non-existent in both formulation and execution of budgets. Even a country like Kenya, where there really is good citizen participation and NGOs are very strong, there was, I think 3 days allowed for inputs into the budget. So obviously a meaningless sort of form versus function exercise where they asked for inputs, but there wasn't enough time. The Asifikeleni initiative in South Africa has been an example that worked very well. So I know I'm using a lot of good South African examples. I'm clearly patriotic. But that essentially allowed for township communities to advocate for improved water sanitation services during COVID, and that improved relations. And now there's actually a formal MOU between government and this Asifikeleni initiative. So we'll carry on after COVID. And then, as I've mentioned, there are many ad hoc committees that were established, and in this case, to actually provide oversight of disbursement. So in Burkina Faso, this management unit comprised members of parliament, officials, the Ministry of Finance, Ministry of Health, and civil society to monitor the use of emergency funds. But we know that even though Parliament was quite involved at the execution stage, oversight was often limited during the crisis. But there were some parliaments who developed agile practices. Even when they couldn't meet, they did introduce, there was the e-parliament in Namibia and Botswana, where they have essentially hubs that were pre-existing that they used to communicate and actually vote on certain things informally. The South African Parliament managed to deploy a hybrid system in just 5 days, so that worked well. And some parliaments did actually maintain their authority to an extent, despite executive decrees. So the Ugandan Parliament, for example, increased the health allocation proposed by the Ministry of Finance back to what the Ministry of Health had actually proposed. So that was a more than 20% increase at what the Ministry of Finance had proposed at the end. I thought that was a really interesting example of Parliament actually exercising power to the benefit of the health sector. And then Supreme Audit institutions have been somewhat of a shining light here. They've brought corruption to light. In many cases, there's been a significant amount of arrests. And there were some that managed to conduct expedited audits. This wasn't very common, but Sierra Leone had experience where they did a sort of what they call a real-time audit during the Ebola crisis, and then did the same thing here. South Africa and Mauritius also published their audits during 2020, but that wasn't necessarily the most common. Yeah, I think that's mostly what I have to say. Thank you.
Brilliant. Thank you very much, Danielle. That was a very, very rich presentation covering a lot of different topics, and I think some of those will then recur, hopefully, or in some of the later presentations and discussions. But I think that really raises both some of the very sticky challenges. Some of those are present in, even before the emergency, aren't they? And yet some agile responses, and indeed perhaps some learning from earlier crises like the Ebola one in the case of Sierra Leone. So thank you very much for that. Please do put any queries, clarifications, questions to the presenters in the Q&A for our audience. But I think we'll move straight on to a more sort of national level perspective focusing on Ethiopia. So Stephanie and Fantahoon, over to you for the next presentation. Thank you, Danielle.
Great. I will just share my screen. Sophie, can you let me know if that's coming up?
Okay. Not as yet.
Okay. Let me see. How's that?
Okay. Yeah, we've got that. Thank you very much.
And you can see the presentation rather than the notes page, is that
yes,
right? Okay,
indeed.
Fantastic. Okay, thank you very much. It's a real pleasure to be able to talk to everybody today. I'm, along with my colleague Fantahun, going to be talking about a program in Ethiopia that we've been working on for the last 4 years or so, called the Building Resilience in Ethiopia program. It's very much a resilience-focused program, as the name would suggest, but it has a PFM work stream, so that's why we thought it might be quite useful to talk through today. And my screen's also not wanting to move on. Resume slideshow, 1 sec. There we are. Can you see that? Brilliant.
Yes, it's moved.
Okay, so here's my the framing for today. I'm going to first of all give a bit of a background. So why is disaster resilience a key issue within public financial management, but also turning that on its head, why is PFM important for disaster resilience? I'll then hand over to Fantahun, who's going to talk through the BRE programme and just a few highlights of our work and with the Ministry of Finance there, and then some reflections to close about how we have engaged with the health sector in our work. So why is disaster resilience a public financial management issue? The reasons why is primarily because disasters, as we know, are a key source of macro fiscal instability. And I think that's really reflected in the chart that you can see on the screen right now. So this just maps GDP growth rates in Ethiopia over the last few decades. And you can see that the dips are really associated with the plethora of crises that this country faces, from famine to conflict to drought, flood, more recently as well, locusts and the pandemic. And similarly, on the fiscal side, we know that disasters can severely disrupt public finances, both because there are additional expenditure requirements on relief and recovery that they bring forward, but also the reduction in tax that we expect in the wake of a disaster. Those two together can threaten to undermine fiscal stability, but also to cause challenges around debt sustainability. And indeed, that's the example on the screen is again from Ethiopia. In 2015-16, Ethiopia had a large drought, and thereafter you can see the tax revenue, which already was at really low levels from regional standards, started on a downward path. Similarly, recurrent expenditure grew, as we see with the dark red bars. And as a result, the difference between what was going out in terms of expenditure and what was coming in grew. And we see that the fiscal balance for Ethiopia grew over in the following years. How does the government fund that? It does so through taking on more debt. And Ethiopia, like many countries in the region, you know, we're facing real challenges with keeping debt at affordable levels. And then another kind of budgetary cost, if you like, of disasters was the point that Danielle actually alluded to in her presentation in terms of budget reallocation. So governments are forced to shift money from planned investments to other emergency expenditures, and that incurs an opportunity cost. We actually did a study in Ethiopia trying to quantify the opportunity cost of COVID-19 related budget reallocations in 2019-20, and that's estimated at 11 billion birr, or $350 million, or 0.5% of GDP. So it's quite a significant indirect cost as well. But I also wanted to make the point that budgets are a vital source of disaster funding, and those of you familiar with DRF will recognize this diagram, which is really just a basic risk layering diagram that says that for high frequency, low severity events, one should keep the risk on the balance sheet of the government and pay for it with risk retention instruments, which are in essence the budget. So that might be supplementary budgets, it might be drawing down on a contingency budget or a disaster reserve if you have those, or moving money between budget lines in the form of virements. So obviously the budget is a critical first port of call for funding disaster response in many of those high frequency events. But similarly for the low frequency events, where if you're lucky enough to have a risk transfer instrument in position, which might be, for example, an insurance policy, more often than not, those will pay out into the government budget. So that just again goes to show why budgets are really important, both as a source of disaster funding, but to channel other sources of risk transfer instruments as well. So I'm going to pass on to Fantahan now. He's going to talk a bit about the Building Resilience in Ethiopia program and our work with the Ministry of Finance there. Over to you, Fantahan.
I think you're muted, Fantahan. Okay. Yeah.
Sorry for that. Okay, sorry. Thank you, Steve and Sophie. I'm very much grateful to provide you a briefing on the BREE program overview and what we are doing. A few of them I will try to highlight. The BREE program, the Building Resilience in Ethiopia, as it is a technical assistance program, which is funded by FCDO and USAID and managed by the Oxford Policy Management. It is based in Addis Ababa and supporting government of Ethiopia to deliver a more effective, more self-financed and accountable response to climate and humanitarian shocks. As Stephanie has mentioned earlier, Ethiopia is frequently affected by multiple of shocks created by drought, flood, locust, and epidemics also, which is the health sector. And then this program, BREE, is implemented in 4 government institutions at federal level. They are engaged in managing disasters and shocks. The first one is the Ethiopian Disaster Risk Management Commission. This commission is responsible to provide appropriate and timely response to disaster before, during, and after the disaster period through establishing a coordinating, accountable, and decentralized system in a scalable manner. Then the DRM work stream, we have 4 work streams. Our DRM work stream under BREE works with the Ethiopian Disaster Risk Management Commission to build capacity in disaster risk management coordination, leadership, mainstreaming, information, and knowledge. The second institution is Ministry of Health, particularly the Ethiopian Public Health Institute, which is under the head. It is an independent institution, but it's working closely with the Ministry of Finance, Health, and providing the health system of the general public by undertaking research on priority health and nutrition issues and working on effective public health emergency management and provide training for public health researchers and practitioners. Then BREE, in addressing the health disaster, is working focused is work with Ministry of Health, particularly with the Ethiopian Public Health Institute on public health emergency management system. The third tasking order, the third one is the shock responsive safety net program. This is working closely with the Ministry of Agriculture. There is a food security office in the Ministry of Agriculture. Then we support, BREE supports the government flagship program, which is called productive safety net. These productive safety net are launched in 2005 and helps chronic food insecure households. And the program is to reduce extreme poverty and then work. Then the shocks responsive safety net work stream is focused on capacity building on shock responsive safety net, the delivery, resource mobilization, and information. The fourth one, which is actually cross-cutting, is finance. We are working with the Ministry of Capacity Building with the Ministry of Finance, and the Ministry of Finance, as it is as I said, it is a cross-sector activity. We are closely the finance work stream is closely working in collaboration with other work streams, including the Ministry of Health and EPHI. As a whole, BRI is much related working with health sector activities. Next slide, Steve, thank you. Then the disaster risk finance work stream theory of change is constructed as you see from the slide. The major, the ultimate outcome is achieving Ethiopia's public finance more resilient to climate and humanitarian shocks, which includes also the health sector. Then to attain such outcomes, the theory of change is constructed in 4 pillars. The first one is, as we see, the understanding fiscal cost of shocks to government. Then here we are working with the Ministry of Finance, filling the gaps. How much in understanding how much the disaster only Lord aspects affects the government budget. Second, we are trying to build capacity, how to limit these costs. We have activities, we are working in capacity building to limit these costs. As it is not possible to avoid or to limit the emergence of disasters, then how to mobilize the resources in a more sufficient manner in the public finance system to address those shocks and disasters. Then if you mobilize disasters, for the pillar is how we are managing effectively and efficiently those resources available in addressing disasters and emergencies. This all activity capacity building tactic orders are expected to manage disaster risk before the emergence of the disasters. That is aiming at shifting from disaster management to managing risks. This is overall the theory of change of the DRF work stream. In doing this, we have several interventions with the Ministry of Finance and also with other focal institutions. I will focus on few. One of them is quantification of emergency fiscal risks. As quantifying disaster risks enables the government to understand the potential fiscal cost of disasters. The Ministry of Finance designs a macroeconomic and fiscal framework, which is a medium-term plan to make medium-term macroeconomic and fiscal predictions. And this framework is actually the basis for the annual budget design. Then as this medium-term fiscal plan is subject to disaster-related fiscal risks, it is essential to quantify how much is costing the government budget. Then at BRI, we developed in collaboration with the Ministry of Finance, we developed fiscal risk modeling, and we extensively provide training to own the model by Ministry of Finance officials. The Ministry of Finance also developed a fiscal registry. This registry is focused on macro variables. Then we, under this tasking order, we try to expand it with other fiscal risks, including the health epidemics, drought, flood, and locust also. The analysis quantifies impact through expenditure, revenue, and the expenditure and the trade balance. As I said, it informs the macroeconomic fiscal framework and the budget by ensuring provisions are made for the risk whenever it's possible. Then this activity is clearly has implication with also the health sector. Steve, next slide. Thank you. The other activities, building climate and disaster budget stacking. The government account system follows the standard chart of accounts, but this chart of account helps to generate government budget and expenditure in aggregate and the sectoral level. But climate change and disaster management is a cross-sector activity. Then the current system, the budget doesn't allow to record each sector's expenditures on climate change and DRM. Then we work with the Ministry of Finance to implement a climate and disaster budget tagging system because this system is very important to create transparency and accountability in the PFM system. Then the climate and disaster budget tagging is it helps the government to track spending on emergencies, which is difficult to do in the normal accounting system. The budget tagging it identifies also what is expended in the adaptation for mitigation, and also it addresses the whole disaster cycle. That is risk reduction, preparedness, response, and recovery. Having this data is very important, essential to address any type of risk and disasters. What we did is we already embedded this into the financial management IT system, which is the IFMIS. And finally, the PFM report will show the extent of climate change in the DRM, investment and expenditures. Hopefully, this will help also the health sector. Next, I think this is my last slide, building disaster risk into the budgetary practice. Currently, Ministry of Finance is being implementing a program-based budget, but then we support the budget directorate and the Ministry of Finance and line or focal ministries, that's the agriculture, health, and the DRM, to improve the quality of their program budget submission with better evidence to justify high requests. Then we work closely with these institutions and support them to produce justified budget. In doing things, what we did is last year in March, we have an embedded expert in the Ministry of Finance working with the Budget Directorate. He has coordinated a field visit, consists of members from Ministry of Finance, Budget Directors, and the XTP and Disaster Management Commission and the Prime Minister Office in the areas where the RMC is operating, and they produced justified reasons. They produced justified reasons to request more budget for the Commission. Then as a result, the Commission has received a 46% increase in 2020-23 budget. Another activity we are working is we jointly work with Ministry of Finance and the Ministry of Agriculture, value for money analysis on social protection program, which I mentioned earlier on PSNP. Actually, this has been started earlier by Ministry of Finance, doing value for money on the health sector. Ministry of Finance did a value for money study earlier on the health sector. Then we extend this to the PSNP program, and this assessment tries to identify how timelines of the transfers and how effective is the program. That means how is attended, it is intended, how it brings the intended results. Then we hope that the BRIE will build capacity in justification of budget proposals in the health sector also and compete for budget allocation. As a whole, our activities are has several implications for the health sector. Thank you. Steve,
Thank you, Fanton. So that's just a taster of some of the work that we've been doing primarily with the Ministry of Finance, but we did a step back and said, okay, how have we engaged with the Ministry of Health and EPHI, and what possible learning is there for health sector actors in engaging in these sorts of PFM for resilience reforms? And here are just a few ideas that we came up with. So the health sector can obviously use the programme budget structure where it exists and evidence to build really compelling cases for ex-ante investment for higher budget allocations in risk reduction and preparedness. Our experience in Ethiopia also shows that VFM analysis can be a productive joint exercise with the line ministry and Ministry of Finance. Often line ministries are quite skeptical. They see these sorts of studies as, you know, a covert audit that the Ministry of Finance is just trying to cut their budget. But our experience is that when it's done jointly, you can actually find resources and improve the justification for better budgets. Health sector actors can also obviously engage with Ministry of Finance-led budget tagging exercises, which will improve transparency of disaster spending in the health sector. And they can be a real support and input into a Ministry of Finance-led effort to model fiscal risks, so providing data, expertise, analysis, etc., so that the Ministry of Finance and the government at large better understands the risks posed by public health emergencies, but also the health costs of other types of disasters. And something we didn't get chance to talk at length about, but one area of work we're doing is around setting up budget contingencies. So all line ministries, but particularly ministries of health, can be important in supporting the development of budget contingencies like disaster funds, which should help improve the predictability of emergency financing. But just to caveat that is to say that we don't want to go down a route that creates too much budget fragmentation, for instance, with lots of different emergency pots of money squirreled away, because that can make it very hard for ministries of finance to manage resources. And thank you very much. That's the end of our presentation.
Great. Thank you very much, Stephanie and Fanton. Again, very rich, a lot of really big topics there. And I think it would be really interesting to kind of write up some positive examples of the points you had on your last slide there. Maybe you're already doing that, but certainly some of those areas like the budget negotiations and you know, have been very tricky. And as you say, have been seen as quite threatening from the health sector side. So that would be great to dig into those positive case studies a bit more. So moving straight on then to our last presentation, which is going to be looking at the subnational level, bringing in some experience from 2 provinces in Pakistan. Majib, over to you, and then we'll move into our discussion phase.
Thank you, Sophie. Let me know if presentation is visible.
It's not visible yet.
Sorry, let me.
Okay, I think it's coming through. Yes,
Yes.
that's great.
Yeah, let me take it to the presentation mode. Is it okay now?
Yep, off you go. Thank you.
Okay, thanks very much. Thanks for this opportunity. So as you have introduced, this is an experience from Pakistan, is essentially focusing on COVID. But before that, yeah, just framing the whole presentation. It's a description of the COVID response in the two provinces of Khyber Pakhtunkhwa and Punjab. We are working as subnational governance program. And of that brief description, I'll try to assess the resilience of the PFM response. We are not an explicit PFM resilience program. We are a standard PFM Center of Government Reform program, governance reform program, but where the resilience within the system helped manage COVID better. I'll focus on those and also some of the constraints before finally summing up the response in the two provinces. So just very briefly introducing the subnational governance program. It's an FCDO funded program, 32 million pounds. It's a 4 years program working, as I said, in the two provinces of Punjab and Khyber Pakhtunkhwa, which I'll call KP, from now on. And the impact that the program aims to achieve is to strengthen democracy and reduce poverty through enhanced economic growth. And the intended outcomes are improved provision of basic services and a strengthened perception of government performance. And we try to do that through 4 outputs. The first output is about, plans and budgets are more evidence-based and executed as planned. So this virtually covers the entire universe of the PFM. The second is about the institutions, essentially to support those functions, planning and budgeting. But ever since the onset of COVID, we were asked to pivot towards supporting that, and the focus has been more towards this, improving the response to COVID recovery and helping with COVID recovery and also climate adaptation. The third pillar is the fiscal space. So this is the revenue side of the PFM, helping government through tax policy and tax administration reforms to increase the fiscal space. And finally, the fourth pillar is the innovative approaches, where we have commissioned researches and innovation grants, which basically are directed towards the foregoing 3 outputs, essentially trying to innovate within these 3 areas. Moving on, so it's a case study from Pakistan. I'd like to say a few things about Pakistan itself. Pakistan is again, like many other countries, is not alien to disasters. We have had a massive earthquake in 2005 with 75,000 plus deaths, and then in 2010 had a massive flood, causing a damage of over $10 billion. And we have recently come out of another massive flooding, and the estimate of damages there is upwards of $30 billion. It's actually 30 million people got affected, and more than a quarter of the country was underwater for several weeks. In some places, it continues even after a couple of months. But this presentation is about the response towards COVID, and it's essentially the SNG's engagement with the 2 provinces. So our contributions are within there, but the way I'll present it is not necessarily as our assistance to the governments, it's how the government's response unfolded. It will have elements of our support, but also the autonomous action from the government itself. So this is, I'll essentially be comparing and giving a picture of the provinces of Punjab and KP. Punjab, just to give you a context, is 3 times or roughly 3 to 4 times bigger than the province of KP, and also contributes as much more to the national GDP. In Punjab, the moment the COVID struck, the immediately emergency package was put together to the tune of about $875 million, and the focus essentially was strengthening the health response, but a lot of that was actually going towards social protection and trying to recover the economy that had suddenly come to a standstill. So after the announcement that immediate package, the government sat and they huddled together, did consultations, and came up with this over the next few weeks with this RISE strategy, which is responsive investment for social protection and economic revival. And obviously it had an element of health response, but largely social protection, and a number of things were done within that. The province has created their own socio-economic registry, particularly the province of Punjab. Job centers were created in some of the districts, and they were then linked with the databases which had information about the laid off workers, particularly those in the informal sector. For instance, in Punjab, I think about 6 million people got affected because of that. And then the other measures included, support to the SMEs, tax rebates, communication with the business chambers, and then, getting their input for the budget itself, focusing on the projects that were, that were labor intensive. And as part of that, we also helped government develop an ADP, an annual development plan prioritization framework, so that only those projects could be pushed through that actually would help with the recovery from COVID. And as part of that, the throw forward was estimated, which was obviously massive, but the part of the throw forward that could actually be feasibly curtailed was about 350 billion rupees, that I think comes to about slightly over $2 billion. So that was the money that was then made available for this response and to support the economy. In the case of KP, it was a similar thing, and they immediately did a budget rationalization exercise, and $250,000 was identified as savings, and some of that was put as part of the emergency package response. Some of that was actually diverted towards social transfers and some to health, but a chunk of that was kept backed by the finance itself as a central reserve, where the departments could actually come and ask for releases. And like Punjab, they also developed their own economic recovery plan, which had similar elements, but to a slightly lesser extent. I'll not go into that. I think in the interest of time, I'll move to the next slide, which gives the picture about the financing of the COVID response. Essentially, it says health department, but essentially it's the health sector response. In the case of Punjab, there are two separate health departments. One deals with the tertiary health, and the second is primary and secondary health. So it's the total allocation, about $1.7 billion. And similarly in KP, and you see those 3 years, 2019, 20 is the first year when the COVID hit, but COVID actually hit in the later part of the year. So that was about in March, when the first case was registered in Pakistan, and the financial year in Pakistan comes to an end at the end of June. So that is the reason you see a significant underspend in both provinces. Let me just have a number. Yeah. So and despite making efforts towards reallocating resources to health response and social protection, within the health sector, you see an underspend to the tune of 13% in Punjab. In the case of KP, it's 24%. And I'll explain why that was the case. But the next year was more rationalized allocations, which saw a little increase in Punjab. In KP, the allocation was more by about 12%, and the expenditure, they were able to spend most of that. Almost 100% of the budget was exhausted in Punjab, whereas in the case of KP, it was 91%. And this is now the year where COVID was acting full blown. And beyond that, as we move into the third year, the allocations have gone up, but the spending patterns have basically fallen back, gradually falling back to the more normal patterns. So I'll now try to assess the response in terms of its resilience in 3 stages. First is the resource allocation. The second is the budget execution, and the third one would be about transparency and reporting. So in terms of resource allocation, the provinces were very quickly able to reallocate funds. So the first port of call was essentially the health departments themselves. Despite line item budgeting, so Pakistan doesn't have, the provinces there don't have program budgeting. So despite line item budgeting, the budget to the tune of about 57% in Punjab and a similar percentage in KP was basically quite flexible. So the principal accounting officer or the permanent secretary of the department was able to move funds from one to the other head as they were needed. Going beyond that, and they were able to then also mobilize resources. As I said, they were not able to use that in the first year because there was significant underspend, but in terms of flexibility and recourse to additional funding, yes, it was available, and finance in both provinces made those funds available to the health sector and for social transfers. And typically it happens in the case of Pakistan through statements of excesses and surrenders, which happens twice a year, where departments come up with their own statements, which are the slow-going programs or which are fast-moving programs, and then finance has the ability to wire those funds from one to the other department, and this is how they do it through the technical supplementary. And even in emergency cases, particularly in Punjab, the finance department reversed some of the releases where unspent balances were available. They reversed that and made them available to the health department. In the case of Punjab, again, and it's the same in both provinces, but this particular case was true only of Punjab. They agreed with the agreement of the federal government to go for a net supplementary where they went beyond into negative budgeting. But it was only the approval that was secured. They did not have to actually go through that. As I said, they had those balances available to them. And this enhanced spend on the COVID was actually more than balanced out by the non-spend in other sectors, because the government virtually came to a halt because of lockdowns and all of that. So for instance, there were no outpatient departments, operations going on, operation theaters were closed down, construction works and projects stopped, offices, transport, every activity came, and there was significantly lots of surplus funds available to the government. Obviously, there was a
sorry to jump in, just to ask in the interests of time, if you could pick just the main points from your slides at this stage so we don't lose our discussion time. Apologies,
okay,
it comes of being last in the presenter list, so, but just to, thank you.
I appreciate that. It's hierarchically, it's subnational, so probably I can live with a smaller time. Anyway, so yes, so that is how it was offset. And it was no different in the other province, except that they did not resort to the supplementary budget in the case of KP. The rest of the picture was more or less the same. In terms of budget execution, I think the policy, the releases were basically policy based. So they were in any case going at the beginning of the quarter. But if there was a particular allocation, then obviously the department did need to make a special request. And since it was an emergency, everybody was on board and releases were made quickly. Procurement rules did have some emergency provisions, and those were resorted to more so in the case of Punjab. KP had their own response. KP actually resorted more towards going to their cabinet rather than making use of the flexibility that was available in the procurement procedures. And there is a peculiar background to that. They went to the cabinet and they got those bespoke approvals. Locum tenens model they used, because the system there, despite flexibility, does not allow them to do it in the case of the HR recruitment. And that is why they went to the cabinet and asked this bespoke approval that was granted to them, and they were able to recruit people against that. In terms of transparency, budget coding, they couldn't do because, again, accounting structure in Pakistan is owned by the Controller General of Accounts, which is a federal function, and there is a political economy attached with that. They couldn't immediately get approval for that. So in the second year, they did come up with a COVID grant, but that was the big demand for grant. Within headwise expenditure coding could not be done, and provinces were not able to report against that. And they did have dashboards quoting the other things, but that was not possible in both provinces. A couple of other factors. Pakistan, as I said, is a federation, so federal government took the lead. So as I said, health is a provincial function, but federal government created this National Center on Command and Coordination Center, and that set the standards and also had those discussions about fiscal accommodation. Federal government also had a large social transfer program that was then, transfers were passed on to the provinces. Most of the procurement was central, so provinces didn't have to deal with that, and vertical reporting was in place, which actually made those reporting and had some sort of control. Some of the other parallel reforms were, for instance, the treasury single account reform was going on in both provinces. KP particularly was able to make use of that, and they had identified about 300 billion plus rupees, which is, I think, about $1.5 billion. And some of that was available for them to move towards the consolidated fund of the province for it to be made usable. Some of the other exercises that we have been supporting the government on is the climate budget tagging. This is subsequent to that. So the both provinces now have their budget coded and tagged, and they can now track the budget allocations and how the expenditures take place. And the other reform that is happening at the same time is the fiscal risk policy and fiscal risk statement that the provinces are now obliged to produce every year. And because of that, they have a greater and a better sight of the disasters that could hit them. And as a result of that, in Punjab, for instance, they made an allocation of 10 billion rupees. I'm not sure whether that is $30 million or some such thing. And recently, when the floods hit the south of Punjab, they did not have to reallocate resources from one or the other head. They had those monies available directly to be put to use. In terms of constraints, so some of the response was actually managed through tertiary hospitals on COVID. Tertiary hospitals have some of the, particularly in KP, have a single line budget allocated to them. So they didn't have those constraints, and they could actually recruit people. HR was a little issue in Punjab, but in KP, as I said, through bespoke approvals from the cabinet, they were able to circumvent that. Expenditure tracking and reporting, as I said, was weak in both provinces, and contingency reserves, except the example that I gave you, which is post-COVID, there were no contingency reserves at that time. Just if summing up, despite no program budgeting, there was a reasonable flexibility available to both provinces to respond to that. The salary budget, of course, was something that was ring-fenced, and they could not venture into that. Even if a recruitment was to happen, that was to be within the allocated budget and not beyond that. As I said, KP went for that innovation and went for a cabinet approval. And between the two provinces, the difference was that Punjab used the existing facility within the system. KP resorted to cabinet exceptional approvals to do that. And lastly, there is this enhanced awareness of catastrophes and disasters, and the allocations should be made available, should be made in the budget. So that's roughly it. Yeah, that's it. Thank you very much.
Thank you so much, Mujib. Sorry to rush you. Obviously, the content has been incredibly rich from all the presentations, and the issue of this centralized, decentralized dynamics and flexibility, risks and advantages of autonomy, I think, is really a critical aspect. So yes, handing straight over to our first discussant, Hélène Barrois, with a wide international experience of these issues. Your reflections, please, Hélène, over to you.
Yeah, sure. Thanks a lot, Sophie, and thanks a lot for the very rich presentations on Ethiopia, Pakistan, and also the regional overview. That was really great. So I'll be focusing on sharing really a few thoughts in the interest of time on resource allocation and budget formulation, really building on what we've learned through the COVID crisis. So in WHO, in the World Health Organization, we've documented actually the PFM modalities that were used by countries during the COVID response with the view to really inform future PFM preparedness so that countries are better able to respond to future crises. So with this framing, I would like to highlight three key aspects, if you allow me, some of which directly relate to the country experiences that were presented earlier. So the first point that I would like to make is the fact that countries have to combine different sources of funding, different financial arrangements to be able to respond to emergency situations. And we saw that with the presentation on Ethiopia. It generally includes activation of a disaster fund or a contingency fund, but also the use of regular budgetary mechanism. But the point that I want to make is that what we've learned, and I think that was also true for some countries that were mentioned today. So what we've learned with the COVID crisis is that both protocols for the different types of emergency funding were generally poorly defined or did not even exist, right? So pointing really to the need to invest in either defining or refining or really adjusting those emergency financial protections so that countries can be able to, I would say, more rapidly mobilize resources for the response. One thing that I would like to note, though, is some, I would say, fragile countries, because I know it's a focus for today's discussion. Here I'm thinking about Sierra Leone or Liberia, those countries who faced the Ebola crisis. And I think they took this opportunity to somehow strengthen their emergency financial protocols. So some good practices sometimes emerging from those fragile contexts and things that we don't necessarily see in more advanced or higher income countries, but are less used to be in a capacity to respond to crisis. The second point that I would like to make is related to budget structure, which is really an important point in my view. We've seen it briefly for Ethiopia, but I think it's also true for other countries. We know that flexible budget structures like a program or an output-based structure allow for more rapid reallocation or reprioritization of the budgets towards some emergency needs. And this is because the built-in flexibilities of PBB allow reallocation within the existing programmatic envelope, right? So even though, for example, as it was mentioned by Danielle, I think even though funding was not necessarily programmed by some countries for vaccines or some other emergency needs, PBB allows to redirect funding quite easily or without, I would say, major bottlenecks, or at least without the need to go back to approval from the legislature. South Africa is always a good example on this practice, but I think also we've seen in more fragile contexts, and here I'm thinking of the case of Burkina Faso, for example. Burkina Faso has actually institutionalized program-based budgeting since I think 2017, so a few years ago already, and we saw that it was an asset actually to be able to respond and mobilize and redirect the necessary funding to respond to the COVID. The last aspect that I would like to very briefly reflect on is actually linked to the presentation on Pakistan, because I think another key component of effective financing for COVID, but potentially for other types of crisis, has been really the ability to transfer the additional resources to the subnational levels. And what we saw is that in other countries having I would say, a robust, pre-existing interfiscal transfer mechanism, so something that is already set up before the crisis. So having that in place has been really key to, I would say, accelerate the access to funding for service delivery units or frontline providers that were really in the first place for responding to the needs. You showed that for some provinces in Pakistan, and we've seen it also in other countries like Argentina and other countries where really it was a strong component of the effectiveness of their response. To conclude, my last word, and probably it's a more general comment or reflection that I would like to bring to the discussion, is the fact that in our view, in WHO at least, we think that the focus for, I would say, PFM preparedness should be really on strengthening regular budget PFM mechanisms to really ensure that those existing mechanisms are adjusted, refined, and really fit for purpose during crisis. And by that, I mean to be able really to focus on those regular mechanisms instead of investing time, energy, policy attention to set up some parallel or off-budget entities that we know they have proven to be very challenging to operate or to be administered during a crisis time. So while we know that in general, such entities or such extra budgetary funds can help accelerate or accelerate spending or remove some bottlenecks in the expenditure chain, we also know that especially in emergency contexts, those mechanisms can create some significant governance vulnerabilities, especially if those entities are managed with very low capacities in terms of financial management, reporting, accountability, and so on. So really, for us, a strong call to really focus on existing PFM systems and make sure that they are better prepared for future chronic or acute crises. Thank you, and happy to take questions.
Thank you very much, Hélène. And I think that relates a little bit to one of the questions we've got in the Q&A, but we'll come back to that in 1 minute. So yeah, really important to bring those sort of high level messages through. So interested to hand over to Maritz and see if we have different supplementary perspectives from the World Bank, and I think thinking a little bit further down the line towards budget execution. Over to you, Maritz.
Thanks, Sophie, and I'll try to be very quick, so we have maybe a couple of minutes for questions and answers. I mean, one of the things that I would like to just highlight is the importance of context and the nature of the crisis, right? And so just to give an example, how a crisis would play out in a country like say Zimbabwe is potentially a lot different than it would in Ethiopia or in a country like Rwanda, right? And so one of the main things that we've seen play out in Zimbabwe, for example, is how the crisis has affected the health workforce, right? So there's rampant inflation and salaries are eroding. It's extremely difficult for the country to retain its staff, and the staff are really at the center of service delivery. So then that becomes not only a question of expenditure management, right? But it really needs to be thought through from a larger macro fiscal perspective of what it is that's going wrong and how some of these things can potentially be addressed, because it really affects the core of the health sector. And it also makes it difficult for partners to be engaged and to support, because this is really core government business, right? And partners, as we know, are can be struggling with paying for wages or supplementary payments or bonus payments and so on. So I think the nature of the emergency response and the context of the country is really extremely important to keep in mind in terms of when thinking through what an adequate response will be. And then the other main point that I would like to get across is that it's important to think through the system as a whole, right? Because emergency spending can really take many forms, and sometimes we tend to focus in on one specific thing at a time, right? So what are the emergency procurement rules? How do we get PPE to the frontline health workers? How do we procure vaccines? What's the role of hospitals and facilities? What are those maybe kind of one or two buckets of things on the one side, and then the other side you have different entities engaging on something equally important, but at a different arm of government. So like who manages public information campaigns, for example? So who manages restrictions during COVID, and how do we make sure that basic care provision, there's continuity in basic care provision during those restrictions? So I think that an important aspect to all of this are the being able to kind of take a step back from firefighting and thinking about how do we strategically engage to get out of such an emergency. And in that sense, you know, it's very much in the spirit of what Hélène said earlier, that having you know, a coherent and strategic engagement in advance to think through how to react to such situations is really absolutely critical. So yeah, let me stop here. I mean, there are a set of specific execution issues that I could get into if there are questions, but I'm just very cognizant of the very limited time left. So Sophie, back over to you. Thank you.
Yes, thank you very much. So once again, I think, you know, I'm at fault for having organised a panel with too much content and too many issues, which could be unpacked in a lot of detail for each of the different areas. But I think really rich presentations, and I think overall the message from the discussants is clear around we need to look at the whole system, we need to look at it in context, and we need to be looking at the kind of how it operates on, you know, at a fundamental level and not just in a crisis moment. And that's actually then already too late to be thinking about some of these issues. I'm aware that we don't have a lot of time for discussion. I'd be interested to hear from the panelists whether they feel there's some particularly urgent items for the research agenda. Obviously, I'm asking this with the researcher hat on, but researcher, as in Rebuild, we work kind of close to policy kind of research. But are there areas that are well documented and others which are neglected? So any particularly key issues that we should be focusing on as a kind of researcher, development actor, community as we move ahead, and then just to highlight, there were a couple of questions. One was really, I think, around what we learned for the broader system functioning from Kate Gooding, which I think we have sort of addressed, but feel free to come back to. And there was one question about the role of performance-based budgeting, program-based budgeting from Hélène. So 1 minute each from each of you, just any final thoughts on that. Danielle, do you want to go first?
Sure. Yeah, I think the disaster resilience and crisis budgeting at the subnational level will be increasingly important, and I don't think it gets necessarily enough attention.
Mm-hmm.
I mean, generally it's the central financing agencies and central ministries that get the focus in all these reform efforts. But yeah, I mean, in the health sector, I mean, 82% of countries have decentralized. So, you know, looking more at the national level. I also am hoping for more work from Stephanie and the team in terms of looking at ex-ante budget reallocations and thinking through more strategically around that. Because as I mentioned to Stephanie, I think countries were really at a loss when this crisis happened about how to cost and how to reallocate and how to do that strategically and coordinate effectively. So I think in giving countries some hints and tips for how to do this and learning from each other with what worked and what didn't, I think that will be useful.
Great, thank you very much. Stephanie, a couple of key areas from your side you want to highlight?
Sure. Hélène had a question specifically about the role of PBB, program-based budgeting, in supporting reallocations in Ethiopia, and I would say it's definitely helpful, right? Because it allows you to see where money was intending to go, what objectives it was meant to meet, and therefore to reallocate based on that information. In Ethiopia, I'd say there's still a shortcoming in that performance information isn't always readily available. So you still have the case that Ministry of Finances are trying to make these reallocation decisions with not much time and with limited information, and therefore maybe cutting investments that could have been really impactful, and with an opportunity cost obviously associated with that. And then Kate had a question about spillover effects, if you like, from these reforms for non-emergency contexts or periods as well. And certainly I think we've got a couple of examples of that in Ethiopia. So the work that's being done around quantifying fiscal risk related to disaster is really providing an impetus to actually publish more about fiscal risks and to publish a fiscal risk statement at the beginning of the budget process, which obviously has implications for transparency and beyond disasters as well. And similarly, the work on evidence-based budgeting, we're trying to strengthen budgets to make them more evidence-based, with the intention that that will get more ex-ante investment in risk reduction and preparedness. But really, as it comes back to your point about strengthening the core system, that those reforms will actually benefit broader budgeting. Thank you.
Great. Thank you very much. Ellen, any final points before we wrap up? I apologize that the time is a bit squeezed right now, but
just one thought came to mind regarding your questions on the gaps in the research agenda. I was thinking that for the accountability agenda, we collectively generally focus on corruption issues, fraud issues. And so now it seems to me that the debate is somehow relaunched when we say, okay, more flexibility should be provided to providers or at the budget level and so on. And so this new level of flexibility should be balanced with a stronger, more robust accountability system and so on. What does that mean in practice? What do we mean by accountability? What does it take? Not necessarily focusing again on the corruption angle, on the fraud angle, but what accountability at the provider level or more generally at the system level, what does it mean from a sectoral perspective? I think this is not something that we, at least in WHO, and to my knowledge, we are addressing in a good way.
Thank you very much. I know, and we always talk about accountability and we talk about autonomy for resilience and so on, but you're absolutely right. Where is the balance? How much does it cost? What does it take? Yeah, excellent point. Thank you. Maurice, any final reflection or urgent priority area?
So there's a lot of talk going on at the moment in the international community on how much is it going to cost, right, for preparedness. Right? Everyone wants a number, right? And everyone wants government to be committed. Right? And I think that's it's very difficult to do that. Like, not only because it's not on, like, it's just difficult to, first of all, agree on what preparedness even means and how much it's going to cost, and it's going to be different from country to country. So I wonder whether this discussion is really going into the right direction. And then, like, now we've heard so many examples on the type of reforms that are meaningful, right? And I think, like, rather than kind of being so centered on a dollar amount, like, I think it would be useful to think through the processes that governments can be committed to, such that they can, once they are in a situation where they have to react, be better prepared. Right? What are the reforms, and how could the community like how can we get governments to commit to a specific reform process such that they're then better prepared, rather than commit to a certain dollar amount, right? And I think that would be a very useful way forward. Yeah, thanks. That's from
Thank you very much, Maurice. And Mujib, any final reflections from your side? I think overall, just to say, the feedback from the conversation is that this is very rich and that people would like to see some more follow-up on some of these topics, so we will think about that in future. But Mujib, back to you.
Yeah, thanks very much. I mean, I think I echo what has just been said. I mean, the only thing that I would like to add is that, I mean, obviously program budgeting is an important objective that, countries should be moving towards. But short of that, I think there is need to look into what are the flexibility or resiliences available within the other budgeting system, which is, for instance, is prevalent in Pakistan or some of the other countries which don't have which have not moved towards that. I think that is an important area that should be looked into, and perhaps there are lessons while countries have not reached there, and they may still be able to respond to disasters.
Great. Thank you very much. Thanks to all our panelists. A really, really rich discussion, and we will consider what kind of follow-up discussions or indeed products or thinking or research strands may be relevant to come out. I think we have opened a lot of topics there and certainly not closed them quite yet, but really appreciate all of your thoughts, your time, your reflections today. Thank you for joining. Apologies for running over a little bit, but big round of thanks, and we will consider possible follow-up seminars to follow up on some of these topics. Thanks for joining and have a good day, everybody.
Thanks, everyone.
Thank you, Sophie.
Thank you. Bye-bye.
Bye, everyone.
Au revoir.
Au revoir.